enjoy learning about other people's achievements. How did they do it? How can you do it? So for the next 30 minutes, sit back and relax while you and I explore these very special wonders that make people successful and interesting. Welcome to my world and Dr. Passes Presents.
The doctors are in. Absolutely. Here we are. And I'm with an associate, a colleague, and we have something of interest to show you. So let's start off with a little story. Have you ever been in a situation where you're talking to someone and all of a sudden they start to fall asleep on you? Or you're watching a movie with aunt, uncle, parent, and all of a sudden you turn around and you see them sleeping. And you go, wake up, wake up. And you see people sleeping during a normal daily routine. What's going on here? Well, this has been diagnosed, discovered, found out. We know the cause of it, and we know how all of this works. And today, you are going to get a chance to learn all about this because guess what? It could be you. You could come down with this condition, which you're going to learn about today. But first, I want to introduce you to my wonderful colleague, and that's Dr. Evan Temkin. Dr. Temkin, thank you so much for taking the time to come down. Let me tell my viewer at home a little bit about you so they understand who you are. Dr. Temkin has been a practicing dentist in Syosset and Plainview for over 30 years. You don't look it. For over 30 years.
Thank you.
And he's board certified in sleep medicine. That's right. And he's been treating patients for these sleep disorders for 14 years now. And you've been treating people on Long Island, Brooklyn, Queens, and Westchester County. So welcome to the show. It's great. And let's start off so that my viewer can understand what we're talking about. It's called sleep apnea. What is sleep apnea?
Well, Dr. Passes, it's a pleasure to be here with you.
Oh, it's great.
I love talking about sleep. Sleep apnea is a restriction of the airway where people are unable to breathe freely at night, and this causes them to get a lack of oxygen, and they wind up tired the next day.
Okay, so let's go on, because I don't want you to tell the whole thing, because then I can walk out of the room and you can just keep talking. So, okay, so now talk to me a little bit about what causes sleep apnea or lack of oxygen to the brain.
Well, when people are asleep and all the muscles are relaxed, the jaw, the lower jaw, can recede slightly, thus causing a restriction of the airway. And that's what's going to cut off the oxygen to people at night.
So I hope you don't mind, but I'm going to ask my viewer to do something. So I'm going to ask you to do something right now at home. It's really simple and real easy so you can understand what's going on. Here's what I'm talking about. Right now, you're looking up, let's say, and I just want you to close your mouth and breathe through your nose. And you see how easy it is. Now, take your chin and go down to your chest and breathe again while you're pushing hard against your chest. Notice that your breathing becomes somewhat restricted. There's a constriction inside your airway, and you can't breathe so well. Is that what we're talking about?
That's exactly what we're talking about.
Okay, so now you understand. So let's go back to you. How does this affect sleep?
Well, when people are unable to breathe throughout the night, your body senses that there's a lack of oxygen getting to the vital organs, and it will take you out of your deep sleep or your REM sleep in order to have you clear the airway, either through a cough or a gasp for air or any way it has to.
So if this happens to someone while they're sleeping, do they wake up? What does the body do?
Well, it is known as an arousal because it is, again, no longer in the deep sleep. However, a lot of times it's not a conscious awakeness, so you wouldn't realize that it's happening even though it is considered an arousal.
So your body tries to arouse you so you can clear the airway?
Correct.
So you can get oxygen in?
Correct.
Kind of like a fail-safe mechanism or something to help the individual so they don't. Well, but wait a minute. Why is this such a big deal? Tell me a little bit first so that my viewer can appreciate this, because when you told this to me, I was blown away by it. Tell me what happened to James Gandolfini and Carrie Fisher, and how our TV show today, our discussion, relates to them.
Well, they unfortunately passed away, and a lot of the cause of that was the complications brought on by obstructive sleep apnea. When people are in this position, the heart will start pumping more furiously in order to get blood and oxygen to the vital organs, and that can then eventually cause damage to the sheaths of muscles that surround the heart.
So what other side effects are there if an individual has poor sleep? Because this really is poor sleep. Because you can be, I'm using your term, you can be aroused. I don't mean it in that way, but you can be aroused in the middle of the night, and to clear the airway multiple times.
Yes.
And that stops your REM sleep, rapid eye movement sleep, which means a really deep, satisfying sleep, and you don't get it.
Exactly.
You don't get it. So what other side effects are there besides the heart maybe having a problem?
Well, that can lead to hypertension. Diabetes is one of the known associates of that. A lot of times people also will tell you that they'll get a full night's sleep of 7 or 8 hours and wake up and feel like they still need a nap.
They're exhausted.
Exhausted, and that's daytime fatigue is another example of it.
Wow. Okay. What about, see, I'm becoming thoughtful now, and I'm thinking about driving a car. Can this be dangerous when you're driving a car?
Absolutely.
Explain.
People, and they'll even admit to this, where they might be stopped at a stop sign or a traffic light and find themselves dozing off.
And the only way they know that they're dozing off, somebody behind them, honk, honk.
Exactly.
And you wake up, you go, oh my God, I didn't know what I was doing.
Exactly.
It's pretty scary stuff.
It really can be.
Which leads me to the next question. And that is now, okay, so now we know about sleep apnea. We know what's causing it with all of the constriction and the terrible consequences that could come from this. How do you know if you have it? What are some of the things that my viewer can do at home and then with a doctor?
Well, let's start with the doctor. These days, people can get sleep tested in the comfort of their own home. It can be as simple as a sleep monitor such as that.
Let me just show you what I'm talking about, what he's talking about.
And now
look at this little thing. Tell me about it.
It gets taped to your finger, and there are algorithms that will determine, based on your pulse, your breathing.
Who?
Algorithms.
Oh, I'm kidding you. Okay, so this gets taped to your finger.
Correct.
And inside here, there's a whole bunch of digital stuff.
Yes.
And it's reading your body?
Pulse. Yes, from your pulse, they can determine the breathing rates.
Can it, wait, yes, the breathing rate. But you did say, see, I listened to you, but you did say earlier, the big problem is the amount of oxygen that you're getting.
Correct.
So this can also tell the doctor
if
the patient's getting enough oxygen?
That includes oximetry.
That's amazing. That's this little thing that's terrific. So you give this to the patient, they tape it, they take it home. How do you get this information? How does the doctor get the information?
So along with the monitor, we put an app on their phone, and the app reads the monitor and then forwards the information to us.
I see. Okay, so it's really that simple. So you get your information like the next day if you need it.
Exactly.
Okay, so that's terrific. Okay, what can an individual do at home to know that they've got to go to the doctor? How do you know you got to go to the doctor?
They may be told by a bed partner that they are witnessing these apneas where they're not breathing throughout the night. They have interruptions. They'll gasp for air. Even snoring is one of the side effects of this.
Well, that was the next thing I was going to ask you. So many people snore. And if they're snoring, is snoring good or is snoring bad?
Well, snoring indicates usually a restriction of the airway, and that will then cause certain folds of tissue within the airway to vibrate, and that's the sound we know as snoring.
So what I'd like to do is be able to show an image of what this looks like when the airway is constricted. So my viewer will get a chance to see. And when we take a look at the image, we can see clearly that the individual is lying down, and then you can see that the airway gets closed. And then the next image shows the airway being cleared, and it's not so constricted anymore, and it's much opened wider so that air can go in and out without the folds of tissue going. Because when you have that noise, what you're saying, that means you're embarking upon obstruction.
Correct.
And which is not good. Is it something only men get? Is it something women get? Or, I mean, talk to me about that.
I would say about 40% of the patients we treat are women. There's a lot of factors involved with obstructions of the airway. And women get it, I wouldn't say as frequently as men, but definitely.
40% is a huge number.
It is.
You're talking about millions of people.
Millions of people, yeah.
Millions of people have this.
Correct.
So this is a big deal. So a woman shouldn't say, well, it's not going to happen to me. It's unladylike.
Actually, I have kind of a funny story.
Go ahead.
About a woman, and this story goes back probably about 11 years ago, where this woman had come in to be treated for sleep apnea. And she happened to be a very attractive woman. And she was explaining to me that even though she knew she had sleep apnea, it was her snoring that was her bigger concern because her husband had kicked her out of the bedroom.
Well, that's so funny.
And I didn't say anything, what I was thinking, but the thought hit me that he kicked her out.
Right.
And she must have recognized the look in my face and confided in me that she was allowed in for conjugal visits, but then had to leave.
Oh, is that a riot? So you helped her. Well, we're going to talk about what you do and how you help. Okay, so talk to me, what has medicine done in the past to help people with this condition?
Well, in the early 70s, they started doing research with the CPAP machine.
Yes.
A way to force oxygen through the obstructions that people were getting throughout their sleep.
Hold it. You said CPAP. I mean, what does it mean? CPAP?
Yes.
What does it stand for? It's an acronym for what?
Continuous positive airway pressure.
Okay.
And
what does it look like? What is it?
Well,
what is this thing?
That's the mask.
Goes over the face.
Over the face, over the nose, in a lot of cases over the mouth.
Right.
And hoses go to a machine that then will force air through the obstructions.
So it's pushing the air open and keeping the airway open.
Correct.
That must be very uncomfortable to sleep with.
I've yet to meet a person that claims it was comfortable.
Right. Wow. Okay. So why? Well, I'm going to hold that question off because I want to ask you what happened. There was a big event that happened with these machines. What happened?
Yes.
Explain.
There was a recall of over 1 million of them.
I heard even more.
It
like
probably was.
Okay.
Yeah. Because there were particles that were breaking off within the hoses and going into people's lungs, because that's where the air is forced to. Causing cancer.
Great. You have a CPAP machine, you now can breathe, and guess what? You get cancer. Well, ridiculous.
Yeah, even before that, there were some other issues that arose with CPAP. The hoses are very difficult to clean. And this means that since there's water droplets within there, bacteria would be forming. And now people would be just pumping bacteria into their lungs, which would cause respiratory infections and things like that.
So now, you are here, and my viewer at home must be saying, what's a dentist doing on the show here? What are we talking about? Why is it sleep apnea? It seems like a medical thing. What's a dentist doing here? Explain, how did our profession, dentistry, get involved in this in an extremely positive way? Talk to me.
Well, we were able to develop a device similar to a retainer, which would position your lower jaw and stabilize it in a forward position, just a few millimeters.
I'm exaggerating.
Yes, you are. But that's a good exaggeration.
Downward and forward.
Correct. And what that does is that opens the airway. I use an analogy when explaining this that if you took a CPR class, they teach you if someone needs mouth to mouth, tip the jaw forward.
Right.
And I can get into a little anatomy with you as to why that works. There's a little bone that's in the back of your throat there called the hyoid, and it's a U-shaped bone.
Right.
And this bone, when the jaw recedes, which it does a lot of times in our sleep because the muscles are relaxed and gravity will allow that to happen, when that recedes, it actually constricts the airway, which is also what allows the tongue to obstruct it easier. It's a good feature when we're swallowing food because it prevents food and liquids from getting into our lungs. But when we're sleeping, not such a good feature.
Right.
So by positioning the jaw forward, that actually pulls that bone forward, expanding the airway. And that's why they use that principle in CPR as well.
So dentistry now has created a device for patients when they have been discovered that they have this diagnosis. Can you show us the device? Oh,
I would love
you
to.
You happen to have one here.
This is a sample of one of the devices. There are many available. We always try to go with the one that will be the most comfortable for a patient, but
it looks like a retainer.
Exactly.
Like after you have orthodontics, you straighten your teeth and you put something in the mouth to stop it from moving. It's pretty simple, and it's got a little doodad on the side here to keep it in the right position so the jaw is downward and forward a little bit.
Exactly.
Right? Simple enough. I mean, you just stick this in your mouth and go to sleep.
And go to sleep.
No hoses, no masks,
and
no
cleaning
particles.
Is very easy.
Cleaning is very simple and easy, and no worrying about breathing in cancer-causing particles.
Correct.
Which is terrific. This is great. Okay, so. So this is right now is one of the best options for patients. What do you call this device? If my viewer wants to know more and go to the dentist or
they
ask
go
question.
with a couple of different names. Mandibular advancement device is one of the terms we'll use, or oral appliance therapy. That's another way we'll describe these. But most people should speak to their physician, their dentist, because it is a very simple and easy way to treat obstructive sleep apnea. You know,
it's interesting. Over 50 years ago, when I was in NYU dental school, I used to learn and moonlight, so to speak, with different surgeons, oral surgeons. And I remember the first thing I did before they got me involved in truly assisting, they would say, stand behind the patient's head, and while they're out, because they did intravenous sedation and they were asleep, they would say to me, take the lower jaw, move it forward, and keep the chin up. And I said, why? They said, because this way it'll stop snoring and they'll be able to breathe. No one at that time thought of making an appliance like this 50 years ago. And it's amazing. They knew, but they didn't understand the application of it.
Yeah.
So there's no question in my mind that it works, because when I would have a patient who's out under sedation and they'd start snoring, and I would then do what I was told from the angle of the jaw, move it forward and down a little bit, snoring stops.
Yes.
The snoring stops. So we knew about it, but look how many decades it took for this to finally see another application and to truly help people.
Oh, absolutely.
When we work together, and when you've done this for patients, and the patients are telling me that I just can't believe I put this in the mouth and I wake up in the morning feeling refreshed.
It is a terrific thing and a life changer in a lot of cases.
Now, you know someone very well who uses this. You.
Myself.
Okay, so what's your experience been?
Well, like you had described early on, I've been treating sleep for about 14 years, and 3 years ago I was told my snoring was worsening. And so I went and got tested with a home sleep study and found out, sure enough, I had mild bordering on moderate apnea, and started wearing one of the sleep devices. It has been a game changer. I never really thought I was lacking energy, but since I started wearing one, it's night and day. I feel more refreshed every morning when I wake up and throughout the day. I'm told I'm quiet in my sleep. So it's definitely something that it works, I would say, pretty much for everybody.
I have now a question which shouldn't be delicate, and I don't believe it is. And I'd like you to get into it without getting into costs. I don't want to talk, any financial stuff, but I do want to ask you this. So my viewer says, I think I've got that. What can you tell the viewer a little bit about how it's handled financially?
In most cases, major medical insurance will cover these in full.
Not dental.
Not dental. This falls under medical as it is a sleep and breathing disorder or respiratory disorder.
Because I know years ago when I would be making these appliances, and we didn't know much in those early years about doing this, and we'd file it because it's a dentist is doing it. So we'd file it under the dental insurance, and they would send it back and say, "Hey, listen, that's a medical condition, and we don't cover that because dentists don't do that. They don't diagnose it or they don't do it." And then we would send it to medical, and they would say they wouldn't even continue reading the insurance form. They would just see DDS, and they would say, "No, we don't deal with dental. You got to send it back." So the question is, who would make payment? They will. And nobody was taking chance in doing this. So, but it's changed now.
Yes, it's come a long way, I would say, in the last 10 years, where medical insurers have realized that this is truly a medical issue, and they've picked up on it and been helping out.
So one of the things that my viewer needs to know is that not every dental office is equipped to handle filing a major medical claim. Would you agree?
Yes.
And why shouldn't that be easy? Just fill out a form and send it in.
It's not always that easy, unfortunately.
But tell us why, can you?
Well, the dentist really has to know the proper coding in order to do it for medical, and the different diagnosis codes that have to be used with it. There's also...
And these are not dental codes.
These are not dental codes.
These are medical codes.
Yes, and you have to be able to show the insurance company exactly what is going on and why this treatment will help them.
So in dentistry, we're used to just filling out a form, putting in code numbers and sending it in, and the patient then gets reimbursement or pays on the claim, and et cetera. But this is different. You have to write a book.
Yeah, it's once you get used to doing it, it's not that terrible, but there's a big learning curve on that.
Big learning curve, and it takes months at times to get reimbursed or payment. So am I correct in stating that many doctors will just accept the insurance for this?
Yes.
So this way, for the most part, to be treated, there's really very little or no out-of-pocket expense for the majority of people.
Yes, that's a very accurate statement.
Which leads me to the next commentary on this, and that is, if an individual knows that their insurance could possibly pick up the tab, what should stop them from getting checked and getting diagnosed? They don't have to pay for it, and they can be helped. Again, commentary.
I really don't have a good reason why they wouldn't want to do it.
Right. So
it was the simplest thing. Again, having gone through it myself, and a fellow sleep apnea sufferer, it was the easiest process, which I was happy for. I was going to get myself checked out regardless. But the fact that it was as simple as going to sleep in your own bed with
with that little device
on your phone, exactly. It really could not be any simpler.
So this is painless.
Yes.
It's very simple, very easy to do. And for your pocketbook, it should also be painless in most cases.
Yes.
And
I would say in most cases.
And you need an office to try to work with you to understand the whole process. And that's not a simple case.
That could be the little more complicated part of that.
Right. Okay. So it's really fascinating because this is a condition that most people just chalk up to. Well, I'm tired today, and they just kind of ignore it. Then in the middle of the day, they start losing steam.
Yes.
And they become exhausted, and they don't realize why. They just figured, I just can't seem to get some good sleep. I can't hit the sack here. So that's a problem. So, well, how did you get interested in this? I mean, you doing general reconstructive dentistry, and all of a sudden you do this.
My father was diagnosed with sleep apnea, and that was about 14 or 15 years ago, and initially tried CPAP and was intolerant to it. And I knew at the time that there were oral appliances that would help, so I made him one, and he loved it. It was actually...
It worked.
Yes, and a quick story with that. So some people will wonder how easy this is, putting it in, taking it out in the morning. My father had Parkinson's, and really his dexterity was terrible by that point.
Right.
But once he practiced a couple of times, he popping it in, taking it out, and so much easier to deal with, and he did really well with it for a long time.
Wow, that's terrific. Listen, we only got about...
Interested.
I'm sorry?
Then that got me interested.
Then that got you interested. Okay, so we got about 2 minutes left, believe it or not. Time goes by like that, right?
Time flies when you're having fun.
When you're having fun. Well, you and I enjoy these conversations. So before you go, I would like you to be able to, did I bring it over here? I'd like you just to sign my guest book, because I appreciate you being down here.
It would be my
you do
pleasure.
that before you leave?
Yes.
And do you have any further information that you could share with us all about the sleep apnea? You got about 30 seconds.
I would just tell people, if you're told that you're snoring, if you're told that your partner sees you gasping for air at night, talk to your physician about it. It's something that most physicians are definitely paying attention to these days and can help you out.
Mm-hmm. Okay, and then from there you wind up in the dental chair. Very interesting.
Yeah.
Listen, Dr. Evan Temkin, I want to thank you very much for taking the time
Dr.
for your
Passes.
busy schedule to come down.
Always a pleasure to talk to you.
Well, I always enjoy talking with you and working with you. So it's just terrific. So I hope that you had a chance to learn something that you just didn't know. I know that this is great information. A large percentage of the population, I don't know, maybe 60, 50, what percentage has this problem, roughly?
I would say at least 50%, probably closer to 70%.
Okay, you could be in that situation. So I hope you learned something so you can use it. And, well, we've got to go. We'll see you again next time. And as I always say, may the floss be with you. All right, so that's corny. Okay, we'll see you soon. Dr. Pass is saying thanks for your time. We appreciate it. Take care.